ಮೆಡಿಕಲ್ ಕಾಲೇಜ್ ಎರಡು ಕಡೆ ಅಲ್ಲೂ ಕೊಡಿ ಸಿವಿ ಇಲ್ಲಿ ಮೆಡಿಕಲ್ ಕಾಲೇಜ್ ಒಟ್ಟಿಗೆ ಬರ್ತಾ ಇದ್ರಾ ಬನ್ನಿ ಡಾಕ್ಟರ್ ಸಂಜಯ್ ಅಂತ ಸಂಧ್ಯಾ ಜೊತೆ ಕೆಲಸ ಮಾಡ್ತಾರೆ ಹೇಳಿದ್ದಾರೆ ಬಿಸಿಲೇ ಇದ್ದಾರೆ ಬಂದ್ರು ಎಂತಂದಿದ್ರಮ್ಮ ರಮ್ಯಾ
What I am listening is that you have to be in a class.
Extra. ಸಂದೀಪ್ ಬರ್ತಾ ಇಲ್ಲ ಹೇಳಿದ್ರ ಸಂದೀಪ್ಗೆ ಬನ್ನಿ ಸರ್ Just going to
And then stop. Stay. Information.
yeah.
Yes, sir. Practicing in dynamics. So, Anita, start.
Very good morning to each one of you. Namaskara. Very sorry for the delay. Since we are embarking on a journey where we are trying to collaborate with government, let us start with a positive note. I request Anita for a rendition. Gurur Vishnu गुरुर्देव महेश्वरः गुरुर्साक्षात् तस्मै श्री शुक्लांबरधरं विष्णुं शशिवर्णं चतुर्भुजं प्रसन्नवदनं ध्याये सर्वविघ्नोपशान्तये गजानन पद्मार्कम् विषम् एकदन्तमुपास्महे वक्रतुण्डमहाकाय कोटिसूर्यसमप्रभा निर्विघ्नं कुरु मे देव सर्वकार्येषु सर्वदा. Thank you so much, Dr. Anita. It was very nice. And coming back to today's program, since long time, I've always felt that either government alone or private institutions alone cannot address the oral disease burden that currently we are facing. And somehow government always feels general health is very important and not oral health. And we all know oral health is part of general health. Without teeth, madam, they cannot have a healthy life, healthy smile, and
Cleanliness starts with the teeth.
teeth. Yes, you have to eat nutritious food, then you need teeth. You need to give a good smile, then you need teeth. So it's very important. So I consider this as a beginning. And I'm happy that not only Directorate of Health and Family Welfare, even Madam from Commissioner, DDMP also has come. So it's a right opportunity for us to say who we are and how we can come together, join hands with the government to address single endeavor, improving oral health of the population. Let's Karnataka be one model state where other states can look at like how private and public can work together. However, this did not start with this. I started visiting Directorate of Health and Family Welfare for a different reason. And I was introduced to Alwar sir, and Alwar sir gave me this idea, madam, we are coming up with CAS, Karnataka Arogya Sanjeevini Scheme. So why don't you take this forward, help us in connecting with other private dental institutions. So it all started like that. Now we have started with Bangalore over here, and online I think many dental colleges must have started. We have provided YouTube link. So with this few words, I also would like to introduce Gopal Krishna sir. He is our registered admin, and thanks for coming in short notice, sir. Our Dean sir and Pro Vice Chancellor Dr. Karpanda are busy with Board of Management, which was fixed all of a sudden. So therefore, they have excused themselves. But I'm sure before end of the program, if time permits, they'll definitely come and say hello to all of you all. And with that, may I request sir to welcome Kala ma'am from BBMP Medical Officer.
Very good morning to everyone. Good morning, ma'am.
Thank you, ma'am, for joining us. Rupa, ma'am, Director, Suvarna Arogya Suraksha Trust. Thank you so much, ma'am. Dr. Anand Alwar, sir, Project Manager, CAS.
He is the backbone for everything.
Dr. Sandhya, ma'am, again from BDMP, right, ma'am? Thank you so much for joining us. Ma'am, before I hand over the platform to you all, I would like to say that public health dentistry is one specialty similar to community medicine. Okay, we don't look at individual patient, but we are worried and concerned about oral health of the population. So all the programs the government has, be it NTCP, National Tobacco Control Program, National Fluorosis Control Program, and NCD, and National Cancer Registry Program, all these programs and National Oral Health Program, oral health is implicit. So we can definitely join hands, madam. Oral health is implicit in all those programs. I'm really not sure how it is being operated, but probably you can explore the possibilities of involving all the private institutions, especially Department of Public Health Dentistry, because we would love to join hands with government because we strongly believe that we can make a difference joining hands with you. I'm not telling the other specialties are not because they are clinicians, they're more worried about the patients who come to hospitals. We are worried about the patients who are in the community. So this is one I would request all of you all to consider. And before we start, may I request a round of introduction from each one of you. Can we start from Ramya?
Very good morning to everyone present here. My name is Ramya. I'm working as the IT executive for Karnataka Arogya Sanjeevini.
And Ramya will be one who will be guiding us to the process of empanelment. Yes.
Thank you.
A very good morning to everyone. I'm Dr. Erika Bhaskar, a first year postgraduate student in the Department of Public Health Dentistry, MS London. Good morning, everyone. I'm Dr. Anam Tasneem, second year postgraduate from the Department of Public Health Dentistry.
Good morning, everybody. I am Dr. Ravi Kumar from Rajarashwari Dental College. I am working in prosthodontic department as a lecturer.
Thank you.
Good morning, everybody. This is Dr. Anjali. I'm also from the Department of Public Health Dentistry from MS London.
Good morning, everyone. This is Dr. Anita. I'm Associate Professor from Department of Public Health Dentistry. I'm with Pushpanjali ma'am, Ramaya State. Thank you.
Yeah, I'm Dr. Shekar, from Department of Public Health Dentistry, working in Ramaya. Good morning, everyone. I'm Dr. Shubha, working in Department of Oral Medicine and Radiology from KRE Dental College, Bangalore. Morning, everyone. I'm Dr. Shruti Ishwar, working in Department of Public Health from KRE Dental College.
I'm Nursing from Krishna Officer. Dr. Murli from Krishna Dental College and the Head of Department of Public Health.
Good morning, everyone. Myself, Dr. Ramesh, working as a professor emeritus in the Department of Public Health Dentistry at Oxford Dental College.
Good morning, everyone. I'm Dr. Rodney, working from at Department of Orthodontics at Oxford Dental College.
Good morning, everyone. I'm Dr. Subhash from the Department of Oral Medicine and Radiology, RV Dental College.
Hello, I'm Dr. Seema. I head the Department of Oral Medicine in RV.
Myself, Dr. Imran. I'm Associate Professor in the Department of Public Health Dentistry and from Karnataka Dental College, Bangalore.
Hello, I'm Dr. Vanishri, Professor, Department of Public Health Dentistry, Marketing.
Hello everyone, I'm Dr. Akshay from BS Dental College. I'm the Associate Professor.
Good morning, everyone. Myself, Dr. Umashankar. I'm a professor of public health dentistry, M.R. Ambedkar Dental College, and also medical superintendent heading the hospital of M.R. Ambedkar Dental.
A warm morning to all of you. I'm Dr. Shobha. I'm from the Department of Periodontics. I'm a reader there from M.R. Ambedkar Dental College and Hospital.
Thank you so much. Welcome all of you. So if you see, the respective deans have deputed all the faculty who are directly involved with patients. So in some institutions, it is Department of Oral Medicine, somewhere it is Public Health Dentistry, somewhere it is Periodontics. So it shows that the faculty are involved with operations, the patient management. So that is the reason they have been deputed. And the deans felt that they are the better people to learn this process and go back and implement. So with that, thank you so much. I also welcome all my friends who have joined online. Thank you very much for joining. So shall we start the program? Yes, sir, over to you. Over to you. Over to you, sir. Madam.
Yeah. Good morning, everybody. I thank Ms. Ramaya College for organizing such a nice program, and I also thank the participants for actively participating in this program. Actually, I appreciate your concern about the public health, but I want to tell you that we have come with a limited scope. Like we have come regarding only the scheme, implementation of the scheme. I'll tell you about the scheme. Public health dentistry is not our scope. Like it is more of Health and Family Welfare Department. We are a part of Health and Family Welfare Department where we implement all the schemes, any health scheme of the government of Karnataka and the government of India. So with this note, I want to tell in brief about our scheme. I think everybody has heard somewhere about this CAS scheme, Karnataka Arogya Sanjeevini Scheme. So this is a cashless comprehensive seamless scheme for the government employees and their dependent family members. There are pure government employees around 5 lakh. So their dependent members are, including the dependent members, there will be around 25 lakhs beneficiaries for the scheme. So we are not at this stage not including the autonomous bodies, boards, corporations, and all. Just to begin with, we have started with the pure government. If we keep on adding, that will be also a huge number. So first we want to stabilize this scheme, then later on think of adding other corporations board, because there are a lot of requests also coming from other departments also. But first we successfully want to launch this scheme. So in this scheme, like we have all Ayush modern as well as the Ayush system. We want to include the dental system as well as the eye also. We are including in ophthalmology also. So I think this is we are the only state in the country covering all the systems of medicines. Ayush, till now we had reimbursement scheme. I think in the whole of the country only Rajasthan is the only state who has done this done cashless scheme for government. I think we are second in the country. But we are also, along with that, we are also including Ayush, eye and dental, which I think they have not done.
Oh, excellent. Yeah. I think we should give a round of applause to great initiative. Great initiative.
Yeah. So the scheme will be like online. The whole scheme is online. We have a software tie up with the NHA. They are giving us a software where the CGHS scheme they are already implementing for the retired government, central government employees. So we have taken the same software. In that we'll be implementing the scheme. In this scheme, like there are three things in this. The first is the beneficiary identification system. Right? This is one of the module of the software where we have to identify the beneficiaries. Whenever a patient comes to the hospital, right, we have to identify the beneficiary. So what we have done is we have a HRMS directorate where we have all the details of the employees, where we make the salary payments and we keep the records of the employees. They have given the API link to the software. So as soon as you enter the KGID number, which is the permanent number, the whole details of the employee is displayed on the screen. So beneficiary as well as dependents with the photographs will be displayed. So that is the way you can identify the beneficiaries. This is the first thing. So as soon as this is done, then it is linked to a software called TMS, Transaction Management System. So wherein you have to check the patient and raise a pre-auth. I think many of you all are already doing this ABRK scheme. If you have done this, you'll be aware of this. Otherwise, it will be new to you. No problem. We'll give required training in this matter. Now, this is only for the empanelment, what we are doing this orientation. After everybody gets empaneled and the whole system is in place, then we'll give another training for operating the software.
Okay.
Right. So that when you raise a pre-auth, the pre-auth comes to the SAS, our office, where we have a doctors who will check the details and they approve it. So online approval is given to go ahead with the treatment. So after the treatment is complete, the patient gets discharged and goes away. Then you raise a claim in the same software. So after the claim is raised, again doctors check the claims, they approve it, it goes to the accounts and you get reimbursed directly from SAS. So this is a cashless scheme for the government employees. Next, there's an option of the beneficiary. Another thing I want to tell you is we are empaneling, we already started empaneling all the already we have a ABRK scheme and organ transplant scheme and many other schemes which we are implementing through SAS. So we have already 3,350 hospitals empaneled, government as well as private hospitals. So a GO has been issued empaneling these hospitals as deemed empanelment. So these hospitals will, for the 6 months, the formalities need not be completed at this stage. They can directly come into the system. They can directly enroll themselves, empanel themselves and start with the system. For new hospitals, we are still the GO has not been issued for the criteria for the new hospitals. That we are discussing with the government, and we have formed committees. We have formed separate committees for the empanelment of dental sciences, then Ayush. We have to have separate empanelment criteria, right, for all the other systems. So we have formed committees accordingly. So we have already proposed to the government the criteria. A GO will be issued, but you can empanel yourselves, but we'll give approval once the GO is issued. So once a beneficiary is there, earlier what had happened is government employees, they had a reimbursement system. They have to come to the hospital, they have to pay, then go back to their departments and get it reimbursed. Now we are doing away with it after the scheme is implemented. Another thing which was a hindrance in actually this was, they could go only to the government hospitals first, then they have to get the referral letters, then go to the private institution. This was a quite difficult thing. Now what the beneficiary can choose any empaneled hospitals. Now at present 3,350 plus more hospitals we are expecting to empanel. So any empaneled hospital, the direct patient of his choice, the patient can directly walk in and start the treatment.
So do you all have any questions or any clarifications required? Ma'am just explained about the CAS scheme. So this is basically for the state government employees, one. And GO is yet to be released, issued. But it will be done, but we can start with the empanelment process. But the list of procedures, ma'am, if I understand, there are no dental colleges as of now. No. In the empanel list, right? We have to start.
Yeah.
So we will be the early birds, probably. Yes.
In BBMP, we already have this cashless treatment. Except for the dental, we had earlier spoken with MS Ramaya and VS Dental College. VS Dental College, and it's moved on, but it halfway it got stuck. So all other specialities, we already have empanelment, and our employees and their dependents already availing treatments at their choice of hospitals, both the government and private. Since 2009, we are running this. So based on our success story, government of Karnataka has taken this to cover the entire government population. So in this regard, I would request all of you to join hands with BBMP also, so that we could empanel your consent and we can extend our treatment. Already MS Ramya Medical College is doing with us with all the procedures, right from maternal care to even cardiac surgeries. But with Pushpa ma'am, you're telling public oral health or public health dentistry is the most neglected part, including myself. I don't take care of my teeth unless it is very painful. It definitely calls me for a visit. So, and imagine the state with the common man and everybody into some addiction these days, whether it is younger population, whether it is the medical students, whether it is the adolescent pocket, everybody somehow government one hand it promotes sale, in one hand they attract, they bombard the health department, what are you doing, what are you doing, none of the indicators are coming out. It is a double-edged dagger we are facing with. So, and our personalities, whether they are different field, they promote everything except for the community health. That is the most neglected part. People come at the end stage, which we can just doing curative and no preventive measures are being done. So we have in BBMP primary health centers, which all of you are well aware during COVID. There was a public-private partnership and all COVID-related activities went on smoothly. We have 8 zones in BBMP, which is headed by health zonal officers, eight of them. Zonal commissioners are there, IAS level now. Zonal joint commissioners are there for every zone. Joint commissioners of KS cadre. You can have an MOU directly with a chief health officer or commissioner for the public part of the oral health, where you could take care of our common man. Primary health center is not a single ward is left out. Every ward is covered by a PHC. And in referral hospital, we have 6 number. And I think VS Dental College, sir knows very well, they have a community wing at our Shantinagar maternity home, sir. And Adgodi and even somewhere in Basunduri. Now at Malleshwaram, a few centers where MLS Ashwath Narayan sir had started off with a oral health scheme. But that should extend to everyone. What I face is, I headed RCH wing also. There is a RBSK team, Rashtriya Bala Suraksha Karyakram program. There is some 23 or 25 teams out there, all BAMS doctors and optometrists and the staff nurse. They are just doing the general health checkup of the school children, empaneled, aided school, government schools, BBMP schools, and the kindergartens of Shishu Mandirs, not the private ones. But those, they just do the oral health, they refer the patient directly. And there is a big number of protocols to be followed for higher treatments, which as a mother, I will get sick of that. So many procedures, so many paperwork, go there, go here. The investigations are not covered, only the treatment part is covered. So many hazards, and ultimately the mother and the child, they'll disappear somewhere. That is what I've seen. We are losing track of the patient. I'm not doing justice to that parent or teacher or the child also. In this regard, if you can empanel with our BPMP for the community health program, a PHCs, you can chart out a program where you cover some of the PHCs. PHCs will be the referral center. You can treat or examine or do whatever it is, and for higher referrals, they can come back to the medical college. In referral hospitals, we have 6 dental chairs, and there is one post for MDS candidate also. But that is always vacant so many times. So medical colleges can directly approach our chief health officer, who will definitely guide you all to take up those dental chairs also for your treatment. Thank you so much.
Ma'am, thank you so much, Kala ma'am. I like to add 2 points. You spoke about urban health centers.
Yes, ma'am.
Now, Ashwath Narayan sir, during his time, he had started 6, which is around Ramaya.
Yes, ma'am.
So, I think 2 weeks or 3 weeks back, we have submitted proposal to Trilok Chandra sir. asking us to allow us to work in those centers. There's one dentist in each of the unit, very well equipped clinics.
Yes.
You ask, everything is there. And the patient load is some 15 to 20 per day. And one dentist is not able to manage. So we have extended our, we are requesting if we can post our interns also, post our faculty also too. First point. And second point, ma'am,
Yes, ma'am.
those patients are referred only to government centers. So we request, please refer them. Consider all the private hospitals, private dental hospitals, make us referral centers, whichever is close by. In fact, we have given that proposal also. The one in Subhadar Palya and one in Netaji. We have given a proposal. Instead of they going to GDC, they might not go.
Yes, definitely.
Maybe now because of the free bus scheme, they might go. I'm not sure. That's on a lighter note, but they don't go.
Yes, madam, definitely they won't go.
Consider Ramaya as a referral center. So like that, each of the dental college can identify the urban health centers close by, and ma'am has made our work easy. She'll just give a proposal, come up with MOU, and we can take it forward. Ma'am, now whom do we approach?
This, I will talk to Trilok Chandra sir and our Japala Sundar, Chief Health Officer.
So the dental colleges interested can directly approach special officer, Lieutenant sir directly, right now?
Yes.
With the proposal, you can speak to your dean, discuss with them, identify the urban health center which is close by to your hospital, maybe one or two. It's a good exercise for interns, for postgraduate, for faculty, and for those patients who cannot get care over there. The care is not, it's not limited, but it depends on the competency of the dentist who is posted. He can just finish off screening only. Or if he is well trained, it can go up to root canal. If he cannot, then he refers. And in government dental college, it is 4 to 5 months waiting period.
Yes, ma'am.
I have pondered that also. So this is the best opportunity for all of us to join hands. Ma'am has given green signal and given us also the channel. With the proposal, with Dean's signature, I think we should approach whoever is interested.
We already have one also in Singasandra.
Okay.
Oxford Dental College is having that. We have 2 chairs installed in that. Our interns will be going there regularly.
But this is government installed unit. The government has put up the system.
Okay. That we will update.
Yeah, that's a system, and inventory management, everything is done by the government. There are certain techniques, sorry to interrupt.
No, it's okay.
So, and Dr. Trilok Chandra sir is a very nice person. He remembers. And it was nice talking to sir, ma'am.
Yes, madam.
He immediately said he will look into it and ask us to meet to So that is one.
It's a great initiative, like to bridge the gap between.
Yes, ma'am.
Yes.
Yes, yes.
That is one thing, and I think allowing you to enter or the referral system is, I think that's a policy decision.
That's what sir said.
So I think it has to be taken up to the higher levels. And coming back to the scheme again. So here in CAS scheme, this is different. That is for public, general public, and this is for the CAS employees. So here the beneficiary will have option to walk into any empaneled hospitals. So he can walk in and he can select the specialist also. So now since we have already started empaneling I think we have the drive like this in SARS, we empaneled even the Ayush hospitals and colleges also. So now we are intending to empanel dental colleges and hospitals. So there are only 4 main criteria for the empanelment. First one is the KPME registration. I think all must be knowing that I think that is a general thing where you have to, for any registration, you require KPME. That is the basic thing. And the second one is you should have the requisite manpower and IT support, because this is being done. One difference between the BBMP and our scheme is they are doing it manually. Here we are doing everything online. So the required IT support, and I think at an executive level it's okay. It is not very high thing. One manpower to manage the scheme and one IT support is sufficient. Then the third one is you should have the requisite, required OT, then surgical instruments and the specialist. You should have. That fourth one is you should have tie-ups. In case you don't have the diagnostic center, imaging center, whatever it is, you should have tie-up with the nearest imaging center or diagnostic center, whatever it is. Then after all these criteria are fulfilled, then you can register, start empanel. Then later on, you'll be signing an MOU. We'll be giving a draft of the MOU. We'll be circulating to you. You can just go through. Then later on, we'll be giving you the package rates. The package is the same CGHS package, which is being followed throughout the country. I think it will be revised in short while. By July, it will be revised. So it will be a very good actually rates package. Will be very revised. Will be a very good rates. It will be beneficial for I think medical colleges and hospitals also. Then the application has to be submitted online. Then you have to designate the signatory for the MOU. Then I think 24 hours may not apply to them. Almost 24 hours emergency will not apply to the dental general clause. So I think this is the thing.
Clarifications. One thing is, yes, the list range of services, ma'am said it will be revised. I just
as of now, we are already in the same CGHS.
Yes. And then
for that we have added. I think we have added some dental and
there are many in the list. I said, sir has given me the list. There are quite a lot of procedures which will be shared. Is there scope for us to suggest many more procedures?
Madam, it is like this. Face to face, your patient will come directly to you. It is not covered in any of those lists. Then you can quote the rate for those procedures for the particular patient. Not you are suggesting a overall this one. You will suggest for the patient. We have got a technical committee who will advise the institute director to go rates approved. At that rate, we will be doing it. It will be somewhere near your estimation only, but it may not be exactly the same as this.
So for all administrative procedures, it will be the same procedure. But later on, if we get a lot of then we will notify.
And one more point. One is I understood pre-authorization is must.
Yes.
Correct. But there is some limit no for pre-authorization. Up to 350, I think we can go ahead providing care or any treatment pre-authorization.
I just asking.
Yes, sir.
For consulting is 350, anybody can come and consult, and we are not straight away, we are not starting the OPD system. It comes at a later stage. Only procedures we are doing it. For consultation, if you are charged 350, you can give the bill, collect the money from the patient, and he will get reimbursement from the system. But if it is converted into the procedure, consultation fees will not be. You should include in the package rate.
If it is IPD, the consultation charges are covered. And now we want to do it in two stages because we want to stabilize the system. So we are starting with IPD. Now we have requested the government to include the dental and eye procedures as daycare and consider as IPD. So this is the one thing. The proposal will be approved by the government. So at this stage, when later on we'll have OPD also after 6 months or after the stabilization of this scheme, then we'll have the OPD also coming. Then we can check the consultants.
So now, ma'am, total time that the limit now, right now, when it start, once we get the GO, we have to start with inpatient.
Yes.
Okay.
Yeah.
And then to start with OPD.
That will be another no. It will take some time. I think it will take another 6. After this system IPD stabilizes, because that number will be huge. We are estimating the beneficiaries to be 25 lakhs. And we have seen the CG just compared with the other same systems also. The OPD will be 1% of the total beneficiary of population, whatever it is. So 25 lakhs means even 1% will be 25,000 pre-auths or claims per day. At this stage, we are not in a position to.
Okay, but it will be done.
Yeah. Okay. It has been already announced in the GO, but we are hesitating, like, since we are not still ready. And then how will this go on? First, this system should stabilize.
Majority of the dental care is on OPD basis.
Yeah.
Daycare.
So that it's okay. Like all surgical procedures or implants.
OPD basis. Oh, daycare. ಹೌದು
ಹಾಗಾಗಿ ಇದಕ್ಕೆ ಬರುತ್ತೆ ಅಲ್ಲ ಡೇ ಕೇರ್ ಅಂತಂದ್ರೆ ಲೈಕ್ ಕನ್ಸಲ್ಟೇಷನ್ ಆ ತರ ಎಲ್ಲ ಆಗೋದಿಲ್ಲ ಸಮ್ ಪ್ರೊಸೀಜರ್ ಫಿಲ್ಲಿಂಗ್
1 hour ಆಗುತ್ತೆ
ರೂಟ್ ಕೆನಾಲ್ ಇರ್ಬೋದು ಇಂಪ್ಲಾಂಟ್ ಇರ್ಬೋದು ಸೊ ದಟ್ ವಿಲ್ ಬಿ ಕನ್ಸಿಡರ್ಡ್ ಆಸ್ ಅಡ್ಮಿಷನ್ ಮಾಡಿ ಡೇ ಕೇರ್ ಅಂತ ಮಾಡಬೇಕಾಗುತ್ತೆ OPD ಬೇಸಿಸ್
No, that is OPD basis only. They can't admit our.
ಡೇ ಕೇರ್ ಅಲ್ಲಿ ಅಡ್ಮಿಷನ್ ಇರಲ್ವಾ
ಗೊತ್ತಿಲ್ಲ ಪ್ಲೀಸ್ ಸರ್.
Good morning, everybody. Our director has explained in detail about the scheme. I want to add little more points so that we will be having the clarity in the scheme, how it runs. The uniqueness of this scheme is patient can select any doctor of his choice. There is no referral either by the government or by the department. Government need not refer. There is only one doctor, that is you. As long as he comes directly, whatever you feel, that's like that. You can advise whatever you wanted to advise. Then if it is less than 350 rupees, consultation and some routine relatives like extra, whichever is less than 250, most probably you can make a what you call bill, give to the patient and he will pay that money, he will get reimbursement from that one. Because we are not starting OPD as and today. We are only for inpatient. Now there is a gray area. What is outpatient, what is inpatient? Now root canal treatment. Though it is done as an outpatient procedure, we call it outpatient treatment. Therefore, we want to include it in the day care because madam was very keen. It was very difficult for us to decide whether it's outpatient or day care or inpatient. All, even the eye surgery, cataract surgery is done, just they take the patient, do it, and within half an hour they send back. Similarly, even the root canal treatment or whatever you do, the patient will come, if we wait for some time and he'll go. But we call it a treatment. Therefore, we want to allow this procedure as a day care procedure. Therefore, whenever you are including in the day care procedure, we give you the consultation charges also for that one and investments if you have done it and the procedure. All the three will be allowed for you. This one, some clarity is required from the government. We talk to the government and they will also clarify it. Most probably, whenever you do a procedure, whatever it is listed there, consultation plus the investigation charges also can be included in this one because this is an outpatient management, medical management like that it comes. And next is NABH. If any hospital is NABH, you get 15% over and above our rates. NABH.
About the package rates.
About the package rate. There is a different rate between RNABH and NABH. All the hospitals which are NABH, they get NABH 15% extra. And Dr. Kala was telling, this public you can start promoting yourself by conducting dental care checkups in your hospital so that our government employees will come to know. And once you can select some department nearby your institution or something like that, they will come and they will come to know more about your college so that they can keep coming. And in cost, the uniqueness is no reference is either by the department or this one. It's very, very important. A very big step we have taken it. In CGHS, the patient has to get a reference. Or in Ayushman Bharat, government doctor facility should not be available. Here, nothing is like this is there.
But you have to get the pre-auth approved.
Pre-auth.
You wrote the pre-auth and you have to get it approved. That will be done by SAS.
Anything more than 350, and you have to write why a particular procedure is required. And we will say approval within 24 or 48, some time we have to put it in MOU. If you don't give it, you can assume that you are given the approval.
It is auto approved.
And in CGHS, I have not seen even a single private dental college empanelment. If any of which hospital is dental college is there, all of you can approach CGHS. They are very happy to take you in Bangalore. The hospitals which are in Bangalore, they can get empaneled at CGHS also. And next is if you have got any own program, you want to do something public health or camps and other things. There is our nodal officer, Dr. Lokesh. He is a deputy director of oral hygiene. He is a policy maker. Approach him, and in government, anything is possible. We should take the initiative. If you take initiative, anything is possible. If you don't take initiative, we will wait for the government. It may take long time. But if you take initiative, yes, it's possible. Lokesh sir is a deputy director of oral hygiene policy maker. And through our commissioner, he can get anything that's possible.
And conclude one with them. Okay. So regarding the claims, we'll give you a list of the the package what is going to be approved for the dental procedures. So you can go through the list. After that, you'll have to agree for the rate and sign the MOU. And later on, about the TAT, you should be worried like how long we will get the money. We are not sure. It's not like that. We are running the ABRK scheme. Around we get 2 lakh claims per month we are getting in ABRK scheme. This is the I think you have heard about that. It is a BPL for the BPL card holder. It is a assurance scheme run by the government. We are implementing agency. It is up to 5 lakhs per family. It is a family rotator basis. We are doing that scheme, and 2 lakh claims we are getting at present per month. And the TAT is just 2 weeks. We are paying the hospitals within 2 weeks of the claim, whatever claim they are raising. So we hope to. The same TAT we are going to continue even for this scheme also. So payment will be hassle-free and it will be very transparent. You need not worry about the transparency or anything. Everything will be done online. And I assure you that if you come into the system, even you will be happy, like for having collaborated with the government and be a part of the scheme, system. And for even you'll be in a way you'll be like for the success of the scheme, even we expect you to come and cooperate with us.
Ma'am, thank you so much for that invitation, ma'am. I think all of us are eager to join with the government. And we're glad that you've given us open invitation. I'm sure all of us will agree for it. Just one clarification, probably many of you must have got many doubts. Now, once the treatment is provided to the beneficiaries, will there be some kind of quality check?
Yeah, that we'll be doing at our level there. We have doctors for that for the quality checks. Even IT system is in place where even audit will be done. So we'll have checks and balances, yes. So
that is one point, but all of us should be aware of.
Yes.
Thank you so much.
We even have a vigilance team, which is headed by the chief vigilance officer. We'll have a team who inspects the office or take a feedback. Yes. Grievance will take the feedback from the employees. There is a grievance cell. Where can the patient, even online it is provided, we provide numbers also, customer care numbers, where any patient can raise his grievance or whatever it is, concern or grievance, it will be addressed. Quality check also, there is a separate cell in our office itself. We'll be checking the
dentists. We'll have a panel of dentists.
Yes.
Okay. It's like going back and reading of a chapter in BERT, financing dental care. So now it is a reality. Thanks for that opportunity. Anybody, any questions?
Just one more thing.
Yes,
I
ma'am.
just wanted to
Yes,
say.
ma'am.
Good morning, sir. Like Dr. Kala said about the public health and for employees. I'm working in BBMP myself and Kala. We are heading this managed healthcare. The same scheme as CAS. CAS is going to start any moment it will start. Our scheme is there since 2009 and both of us we are there and single window. You not to worry, only we two are there. And I am working with CAS also, just OD I am going for short period. And second thing is we want medical colleges, dental colleges and clinics also. In the clinics in the beginning only 1 or 2 people came, they didn't even turn up because of the low rates. And the medical colleges, medical dental colleges, if they come now, we'll be very happy. Please join immediately because it will be a pilot project for you to join CAS. CAS shortly they're going to take you guys and you can be with us immediately. And then today and tomorrow you can join. And the same procedure, same thing, single window and no approval and OPD is there. Directly the employees will come with a health card and they will take the treatment, consultation and procedure charges, everything they are going to pay.
Including medicines.
Including medicines and investigations also.
And once we make MOU, how frequently it should be renewable?
Once in 2 years.
And Sandhya ma'am, you said come now.
Yeah.
So
Immediately.
how immediately?
Because I'll take Oliver, mail IDs and tomorrow only we'll just send a letter to you and we'll send the copy of MOU to you. You can immediately. And usually for the MOU approval will take 1 to 2 weeks. Then it's done.
It applies only for colleges in Bangalore.
Yes, for medical colleges.
I have a doubt. Now we are taking an MOU, so your referral will be from BBMP to the.
No referral, directly employee will just walk in. Yeah, we have around 6,000 employees, including dependents is 30,000.
Okay. And what about the payment?
Payment on credit basis will pay.
So cashless or?
Cashless, cashless.
You have to still on cashless.
Yes.
And then
Employee, yeah, you are not supposed to collect from the employee.
No, certain procedures it does not come. There is no such thing.
No.
No capping.
No capping.
You can give an estimate that will approve.
Yeah, estimation approval you have to take if it is more than some lakhs or something, or more than 50,000. Otherwise.
Do you also have, sorry. Yes, sir. Sorry.
Regarding CGHS, what we call it, I'm from Dynasty Dental College. We had applied to CGHS, but they never responded. And for almost 2 years, I think the application is still pending there. And then later we came to know that crores of rupees is not being paid through CGHS. So that's the reason nobody is applied through CGHS.
No, sir, I will just clarify 2 things. The scheme was running very nicely with UTI. Suddenly,
No, sir.
I'll explain to you, just 1 minute. The NHA took over the software part from UTI to NHA. Initially, the software, they thought it was very easy, but they did so many mistakes in the software and blunders. And they were no way they could able to track the whose application is there, what is there, how much money is going there. There was chaos, utter chaos for 2 years. And 2 years, there was no money payment for many hospitals. That's how many majority of the hospitals walked out of it. Now the software is stabilized and payments are made within 15 days, there is no issue. And regarding the empanelment, the primary criteria is NABH. NABH is a mandatory. Any hospital with NABH, they can go even now. The stabilization of NHS software, that was taking the time for new empanelment. Now, if you are interested, I can speak to CGHS.
One more issue is they are asking for a partial deposit of 1 lakh or 2 lakhs. So that is not acceptable to most of the management. Why should the college pay partial deposit when they are dealing for such a small rate? I don't want to give a partial deposit to CGHS.
This one I will clarify you. In cars, we don't have any partial deposit. 1 minute. We don't have it. In CGHS, it's possible. In CGHS, it's there. This is a decision by the ministry. Therefore, they are too powerful. No, none of our words or suggestions will not go with them. They are too big people. But why they want to take it is the simple reason is if there is a over collection from the patient, you have taken some money. They want to recover that money. It's only bank guarantee. You need not deposit that amount. It's only guarantee. The bank says we will assure you if something goes wrong. It is never encashed. As far as my knowledge there, I was 35 years in CGHS. It was never encashed. But somebody does some over collection or something, that money can be recovered from that one. With that one only they are kept it. It's a bank guarantee, not a deposit. Therefore, for guarantee, if your reputation in the bank is so good, without charging anything, bank will give the guarantee. Therefore, money is not really going from your hand.
So, but bank guarantee has to be given from the management account.
That's there, but only in case you fail. Otherwise, we are not really going to see that money is coming on us.
Also.
UTA is gone, sir. No, it's not there.
Yes, we have demands. In 3 years, they got it to the government. 1 rupee for all the treatment which were there. Because in UTA, they are going to third party, UTI. And you have to apply to UTA and they have to clarify and so much of procedure. They are paying only 100 rupees for one infection or something which we charge 1,000 in our other places. And for that 100 rupees, you have to fill 100 forms. And after that, you have to wait for 6 months. And then they take a service charge of some 5 or 10% and then they'll give you the money. So all this is causing problems for the colleges. And you cannot keep one doctor to do all this, or you cannot employ one person to collect this money. So that is the issue with most of
I will actually do 2 things. One is staff is in no way concerned with that, except the rates. We don't have anything to do. We don't have any bank guarantee system. Patient comes directly to you where it was referral system, and you are the person who is going to decide the treatment. It's not somebody else is going to decide the treatment. In that way, it is very great. Regarding pending bills, Dr. Ravindra Singh is there. He will take care of your concern. I know him. If you want, I can speak to him also.
See, one thing I want to explain is, I'll tell you a little about our backgrounds also, then we'll be in a better position than us. I'm Director Operations SAS, taking care of administration of SAS. I'm also in additional charge of Joint Director CAS post. So I'm also in charge of this CAS scheme. So both I'm looking after. She is Dr. Sandhya. She is MOH at BBMP. But she is in also additional charge of a CAS program as a medical officer. He is retired from CGHS. Now he is working as a project manager for CAS on contract level. The another 2 people, deputy director, they were on leave today, otherwise they would also come. He is the deputy director, Dr. Mahesh. He is from Department of Health and Family Welfare. So now he is taking care of this project as a deputy director. We have also Dr. Sandeep Kaur, I'll share you his number. So he is in charge of the empanelment process. So we are the core team for this CAS scheme. So this scheme has nothing to do with CGHS. Okay, we are only taking the NHS software. So this empowerment will be different. Here we'll have only
problem. Why people are not coming forward. These are the things.
So this will not be a problem for you in CAS scheme.
We are facing these problems and we are putting forward.
This is a state scheme. Okay, this is a fully funded. This is a contributory scheme actually. Now GO has already been issued where even the beneficiaries have to contribute. But till the OPD is in place, we are not collecting the contribution from them. This will be at a later stage. The balance amount is state funded. So the payment will be seamless. The software may have some issues, but we see that it is addressed, or we'll may take another software also, which we are running the ABRP scheme. That is one thing. And the payments that we try to maintain the turnaround time up to 2 weeks. Within 2 weeks, we make the payments, and we'll have no problem regarding the thing. So we are here mainly to concentrate about the scheme and empanelment of the scheme. That CGHS is out of this contact. Later on, you can start.
Came to my mind when I made notes. Some of the colleges have come to what is the problem with it?
And the beauty of the scheme is
To be associated past.
Yeah.
We definitely empanelment.
Yeah.
These are some technical glitches which we have. I want to put forward before we get into this. That's it.
Yeah.
Sir, what madam said is beauty of the scheme is that in government within 2 weeks you're getting money is the first time it's happening here.
Even
She
they are
got
part of
very
the
well.
scheme.
Yeah.
They are knowing that these stages, and we have even big colleges, private colleges. We have also produced. We have also employed a staff there known as Arogya Mitra. In all the private colleges, even though it is a private college hospital in ABRP scheme, we have one Arogya Mitra whom we have appointed, who helps the medical coordinator to upload the pre-auths. He collects the beneficiary details from the beneficiary, and he fills up the form A, Arogya Mitra, and assists the hospital. We have provided one staff for the pre-auth. So I think if the scheme is extended, we may look into providing Arogya Mitra, where we get more than 300 load. Yeah, 250 to 300 pre-auths per month. We'll employ one Arogya Mitra to assist you in this.
And you need to give one counter. And it will be helpful to you also.
So the raising of the claims should be from the hospital side. We only give our employee for uploading of the pre-auth. Claims should be done from here. You have to have one data entry operator. I think in other hospitals and all, in the regular allopathy system, they all have one person for the schemes. I think they already have one person. I think that same person can be used for that. And for medical college, maybe will be a new experience. And when you get more patients, then I think you can also think of appointing one separate staff for this.
And one more thing I need to thank madam. SAST has given a big opportunity to dentists. I think more than 250 people are working there. Very nice, like it's almost like a corporate environment. And very nice. Majority ladies are there.
Very good. Visit our office also.
Thank you, madam.
And we are doing all this in-house. We are not given this to any third-party agency. We are doing all pre-auths and claims in-house. We have appointed doctors. 110 doctors are working from home. All these are all specialists who look into the 2B, 3A and 4A cases, emergency and tertiary cases. 2A, all simple secondary cases are done by dentists in office. There are around 25 working in office and 40 people working from home.
Are they looking at dental procedures or medical procedures?
All medical procedures. Trained in medical, they have become medical doctors.
Dog bites, appendicitis and all, we are giving it to them. Dental is not there in ABRK. Yeah, 2A cases all done by major chunk is the 2A only. Around 80% of the claims will be 2A. And 2A is exclusively given to government. It is not to private hospitals. It's only tertiary and emergency. It's only to private institutes.
Okay.
And
Well,
it is done by specialists who work from home.
Yeah, general part is done by dentist too.
Specialists who work from home.
Okay. Yeah. So we are happy that the dentist.
Yes, sir.
Yes.
There is no medical doctor in SAST actually. Everywhere doctors are there or dentists.
Okay.
Even up to assistant project manager, it is dentist.
Yeah.
The project manager and director medical management is MD.
So once the dental institutions are included, the same team will continue. Or
No, we'll expand. We'll have a separate team.
Any other questions to ma'am before?
First of all, I would like to thank Dr. Pushpanjali ma'am for organizing such an event where we have a discussion on this empanelment system. This was actually lacking in the country and in the state. And we are running a ESI empanelment for the last 6 to 7 years. And UTISL, as the doctor raised the issue, we have not faced any such issues. The payment were done in time. It was from our side, there was some lacking in entering and claiming the thing. And as far as CGH is concerned, it is the NABH which they want for all the dental colleges to have an NABH, and without NABH, the CGHS is not coming forward. That's why one of the limitations the colleges have not come. And coming to the BBMP, Dr. Sandhya ma'am, I think we talked in the phone a couple of times, and I've even received the MOU copy, draft copy, and the requirement list for the BBMP empanelment. And very soon we would like to get along with the BBMP schemes, ma'am. And the third thing, caste is one of the things, like the major chunk of the state government employees are the beneficiaries, and walking in, it's nothing like that. All dental colleges, I don't know how many will agree, we were thinking that patients will not come. Those patients who are coming with their poor, they are not getting. And whatever the ESI and CGHS charges from starting from number 150 coded till the 230, there are so many 52 procedures, which is in the ESI and CGHS list. Entire thing we are doing at the either similar charges or even 400 to 500 rupees little extra. It is not something like the colleges charges is varied from the charges what is given there, except for major surgeries. This is what my experience, because I'm the direct person who are running with the ESI empanelment and ESI charges and how it worked, and I think what I've seen in my personal experience. And that's why from our college, we are looking forward for the CAS. We want to get empaneled with the CAS. And even if the opportunity permits, like CGHS, as you told, we are very much open for the CGHS, and we are going for an NABH. As soon as we get the NABH, this thing, we would like to come into this. And thank you for proposing this, and we are very happy to join in with you people.
Thank you so much.
Yeah. We already have, I think all the colleges have a MOU with Dantabhagya Yojana, which is also done through the Ministry of Health, Government of Karnataka. So the same thing can be extended or something, maybe the same MOU could be extended, or do we need to go through the whole process all over again?
No, this is a separate software, separate scheme. Dantabhagya is, I think it's for general, is it for general public?
That's for PPL.
This scheme is exclusively for government employees and their dependent family members.
So it does not involve the.
Yeah.
Just one more pointer when it comes to BBMP. Unfortunately, Dr. Kala is not here. I represent Krishnadevara Dental College, which is in Hunsmarnalli, and their nearest PHC is Bethalsuru. It took almost 10 years for us to get a agreement from the BBMP and the concerned people to set up a dental unit. We only ask for a space to be provided. We are ready to get a dental unit and have regular staff to go there and provide services and everything. After all the efforts, just about last week, we got the final approval to go set up the chair. So we had to do all the work and then establish the chair and the process. So it's been a very tough process. It's almost been 10 years, and I hope that in future things won't be this difficult to associate with BBMP and other services.
Yeah. Now Dr. Tilak Chandra sir is there. He's a medical doctor, like he be easy, sir. Why don't you approach him?
Okay, sure. Now, it's finally through, so that we are hoping that we won't have any more problems with the thing. So,
Ma'am, regarding pre-authorization, in case of emergency cases, also do we need to take a pre-authorization?
You have to raise a pre-auth, but it will be auto-approved. You'll have to raise a pre-auth. But for emergency, it will be auto-approved.
Situation also. Patient vaccine or emergency.
Yeah. No, you have to see the codes. We'll be publishing a code in that. If it comes under emergency, then you upload it. It will be auto-approved. Yeah. So it is not required for a doctor to see and approve it. It will be auto-approved.
I think it's a good approach. I think CAS, whatever the procedure has been followed, it's very clear. We have to get empaneled and provide our services. I think you have already offered, cashless services, 2 weeks assurance. I think, this scheme should go on. And I think it's a great effort from the government. You are coming forward. I think most of the private colleges will be more than happy to join. This is what I have to say from my end. Thank you.
So Imran is coming from Mangalore. Mangalore. Excellent.
Ma'am, one more thing I wanted to just clarify with you, because already ABRK scheme is running through our medical colleges. And why don't these SAS costs also, because the medical college and dental college is run by the same management and the same administration. So is it not that is enough for the empanelment? You want the dental colleges to be have
Yes, this is a separate empanelment. That is the separate software we are using. This is a totally separate software.
Okay.
Actually, if we had adopted that software, it was not required.
I think for our medical college, even SAST is there medical college. So,
For medical colleges.
Yes, yes. If you have a KPMA restriction, that is the primary criteria. If you have a KPMA restriction, you can empanel yourselves.
our medical college is with SAST and the ABRK scheme. They are for all other scheme also they are running. We as a separate dental college.
You need not pay the empanelment fees.
Okay.
And for the 6 months, you'll have time to complete the formalities like signing of the MOU.
Okay.
You can immediately start the treatment up once the GO is issued.
Okay.
So you'll have 6 months time. We consider you as deemed empaneled. If you're already empaneled in the SAS.
Our medical college is empaneled.
Yes, if it is, but is this a separate unit or separate KPME registration?
It's a separate KPME, medical college registration. There we have a dental department where the dental cases, can they take the dental cases there in the?
It's a separate entity, I think, dental hospital.
The way cost is defined is, if an institution is empaneled under cost, whatever the facilities are available in that hospital, all things should be extended to the patient. Okay. If medical college has got a dental unit, not dental college, Ramaya Medical College is empaneled and there is a dental unit, we are bound to extend the services to cost. Okay. But you should be empaneled under cost.
Yes.
Yes. First, college has to be empaneled and there should be a department of dental in that college. Then they can extend it. If college is a dental college is a separate entity, then they will also get empaneled under that.
Madam, I have one thing. All this thing scheme is very good, but everything is focused on treatment. If we are looking for prevention-oriented programs, if we want to conduct some programs, because public will come only if they have problem. Whether they have problem or not, or it could be prevented at an earlier stage. Focus on each target group at the earlier age, like children, adolescents, adult, and geriatric. Can we overlook for something like preventive programs in this scheme, where everything, like if we get empaneled with dental colleges, can we have or look for an MOU for preventive programs, irrespective of whether patient is suffering or not suffering? Every year, twice a year,
That is the way it has to.
Twice a year, some programs with the enlisted dental colleges or.
But currently it is not there. No such thing.
Because
maybe
one comes at the later stage. So. See, this is not going to spend anything. If you are if we are associated with you, you give us a request like come and do the camps or come and do some community programs. We can identify.
I think in last 15 days we had a similar workshop for orientation for the Ayush department also actually. In fact, they were also wanting to conduct camps. So if you want to conduct camps, we can give an opportunity in Vidhan Saudha Common Park. There's one KGAD association, Karnataka Government Employees Association, Secretariat Employees is there. So you can approach the president. We'll give you the contact numbers or we'll help you to approach them. You can conduct camps where all the, I think in Vidhan Saudha, Vikas Saudha MS building, I think nearly 5,000 to 6,000 employees are there. So you can conduct camps there. You can take a time. You can book the venue and conduct camps where they can come and get the treatment. Also, even in Arogya Saudha in our office, we have around 1,500 employees in the one building. So
schemes which focus on school children, schools which are covered under your area, where government schools or anything.
That is not under our school.
It doesn't come under class.
It doesn't come.
Employees, government employees.
There is a RBSK for this actually. On the school program, RBSK is the right program.
And Dr. Kala explained about that. Public.
I know, she explained about that. But I think focus.
In our scheme also, when the employees comes, you can ask you can have a screening yearly twice or something like that.
Because
was
we'll have
about
the medical
yeah,
checkups and our annual
screening
checkups.
programs.
It's the same way, I think you.
Another way, probably what I think is any government office close by to an institution.
Yeah.
You can go and advise them, yes, forward hospital. But that will be institutional responsibility.
Yes.
If we get empaneled, the ownership on us, how we mobilize them actually. There is the 30 lakh people, how we mobilize them, it is our public health part, I think. If I.
ಈಗ ಮಾಸ್ಟರ್ ಚೆಕಪ್ ಮಾಡಿಸ್ಕೊಂಡ್ರೆ ಹೋಗೋದೇ ಇಲ್ಲ ಹಾಗೆ
We can.
Someone has a question for you.
Yes, sir. Dr. Gopakrishna, sir.
Yeah, we had an empanelment long back, madam, for the BBMP.
Yeah.
So many patients came and probably we treated them also, but later it comes to the salary payment and other things. We fail to recover anything. And still patients come and tell that we have still got empanelment and we feel very sad to send them back.
No, we are ready. I don't know why it has stopped actually.
Yes.
And directly, whatever the bills, your bills also you can submit to us, and you can continue with the same empanelment. Need not to go for other new.
Have still the
Because you can
MOU
go for the
signed with
renewals. Renewal now,
the
and you can just.
employee, the doctor's numbers are there.
Yeah.
They keep calling, so we can start with the
Sure,
same.
sir. Sure, sir.
Ma'am, renewal is must or?
Renewal is must.
Yes.
Long back, 2014, ma'am.
Correct. Immediately we can start.
CGP empanelment, like we need to contact Dr. Trilokchandra.
No. Contact me will give, because I'll collect your mails.
Okay.
We'll send you tomorrow letter to you. You can contact.
Ma'am, one more doubt. What is the approximate fees for the empanelment?
BBMP no fees.
There is no fee.
The stamp paper, you have to give your.
In cost, there will be empanelment fee for 5 years.
Approximate cost of.
Approximation, it is not a government notified, approximation will be around 20,000, maybe.
You ask the government not to.
It's not, government is not notified.
This MOU, like in the future when we have to renew and all, will there be a process or it will be an online?
We'll inform you well in advance, once in 2 years.
Will it be online or we'll have to go?
Once in 5 years, I mean.
5
Yes. No, we have to, it will be possible online or it should be direct in person? No, MOU will be physical. It should be signed on a stamp hard copy. So usually we have a long protocol. It goes from one table to other. It's a long time.
Partially, what
It's very simple. No?
Just say you can get it.
Once you enroll, we'll give you a draft MOU where you will sign and give it back to us. We'll sign. Yeah. It's a single window. You need not go to any office, only the criteria, if you have all the registration and all the criteria, if you fulfill, you need not go anywhere. We've been facing difficulties with urban PHCs. It's been more than a year.
That is different actually here.
So we just don't want the same. Want to change the whole, yeah. I just want to have a seamless system like. Yeah.
And BBMP is also going for online, like we wanted to. Now the payments is 1.5 months to 2 months, max 3 months, within 3 months we are paying. But we want to go for online, shortly it's going to happen, within 6 months.
BBMP is for employees of BBMP employees.
I'm coming from the rural college, KGF Dental College, KGF. Is this class applied there also or only for?
No, this is applicable to all
Karnataka, not all states, all Karnataka.
So we can also.
Yes.
How healthy is your finances? Because Dantabhagya keeps switching off every few.
ಕಾಸು ಬಗ್ಗೆ ಒಳಿನೇ ಮಾಡಬೇಡಿ, ಯಾವಾಗಲೂ ದುಡ್ಡು ಇರುತ್ತೆ.
ತುಂಬಾ ದುಡ್ಡಿದೆ.
Employees are contributing amount. And employees are 40,000. If I don't give the service, they will, who don't keep it, they will write it later.
More demanding will be there.
There will not be any problem. Regarding funds, we not doing.
Because Dantabhagya, we keep getting notices, stop the services for now until we give further notification.
For example, if 2 colleges are empaneled, so the patient goes to one college not happy, comes to another college, still everything will be same. No, I think separate pre-op, we have to cancel that. If it has been in half-candid case, half treatment ಮುಗ್ದಿದ್ರೆ ಅಂತ. ಅಂದ್ರೆ they are not satisfied with the first half. Like first treatment is
It is not like that. But every procedure is a pre-op. Once you have taken the patient, you have to complete, then only you get the money. If the patient has left without the procedure, It goes to the next hospital, the next hospital will get it because they have got the
Cancel
visa
the
and they have
pre-auth.
completed.
Cancel the pre-auth.
Unless you complete the treatment, you will not get done.
So what will happen to the previous college where if the patient is left?
Have to cancel the pre-auth.
Whatever you spent it all.
Consultation ಅಷ್ಟೇ ಬರುತ್ತೆ.
Consultation
Whatever
ಬರುತ್ತೆ,
is done,
investigation
those
ಬರುತ್ತೆ,
procedures will take.
those things you get.
Because sometimes we have multiple sittings for each, one treatment.
Yeah.
In that case, then
So once you have raised the pre-auth, whatever treatment you have given, for that you can take.
You can get.
Will there be a patient signature
Yes.
required to submit the claim?
There are two things. Patient has to give certificate that they are not, you are not collected any money from the him. Yeah, and he will say satisfied.
So hard copy or online?
Hard copy will give you, you submit to us.
Online, yeah, you scan it and upload.
So all those forms are ready, will be given by.
Yes, yes. It will be a part of the MOU, all the forms.
And everything will be online only. No hard copies are received by the extras.
And training also given.
Very.
So there will be some kind of manual.
Yes.
For the
Yes.
panel.
Hospitals,
institution,
yes.
Hospitals.
And there is the website also. We will give each and every details in the website.
Yeah, not release the website. Once we release you, we'll give you the ID.
Okay.
So everything will upload on the website.
Even MOU, application for you submitting the claims, everything will be there in the website. There's nothing you.
We start with the procedure. So here now we have a IT person also. If you have, everybody has gone the laptop, you can start the empanelment. You can submit the application form. They'll be guiding you like online. They'll show how to do it. So we can start with the.
Yes, ma'am, yes, ma'am. If there are no doubts regarding costs and anyway, ma'am said that tomorrow she will send mail to all of us. We'll collect email IDs.
Share your email
So that part is done, BBMP. Yes, Dr. Ramesh.
Is it the employees who are still serving the government, they are only involved or retired people?
Government employees, we also propose another scheme to the government, so that will be a separate scheme.
Okay, thank you.
This is regular
Employees, serving employees.
So there's clarity regarding BBMP now. Ma'am will send mail to us tomorrow and we will take it forward. So at the moment, I think we will focus on CAST scheme and its process. So if there are no clarifications regarding the scheme, then ma'am is suggesting that we'll go hands-on on how do we apply. It doesn't mean that we are going to submit. It's only to understand the process.
No, you can also submit.
Submit, okay.
They will submit the email. There's no commitment on your side. Until you sign MOU. Nothing is, and this doesn't have any.
Only after the GO is issued. It will be like, you can complete your submission.
So,
Name certificate and phone.
have a template already. I have a template for it or I have prepared one. Actually, name, designation, email ID, name of the college and phone number. Address. ಅಲ್ಲಿ ಹೋಗ್ಬೇಕಾದ್ರೆ
ಅಲ್ಲ ಹೇಳೋದು ಹೇಳ್ಬೇಕು ಅವನು
So much. Thank you for on the whole office. We were only concerned. Yeah. And you can have a. Yeah. Go to the weekend. Okay, well, partly my own very much. Yeah. I would consider subjects of okay. And you don't come back. Yeah. I will stay back for some time. Yes. So Anand. Yeah. Yes, I'm coming.
Online over there. So the online yeah, so online preparing. And it depends, right? ನಾನು ಇದು ನೆಟ್ವರ್ಕ್ ಹಾಕೊಂಡ್ಬಿಟ್ಟು ಮಾಡ್ಬೋದು ಸರ್ ಇದೆಯಾ ಮಾಡಿ ಏನ್ ಮಾಡ್ತಿದ್ದೀನಿ ಸ್ಪೇಟ್ ಬಂದು
After submitting that proposal to the general
ಆನ್ಲೈನ್ ಪ್ಯಾನಲ್
and reference hospital I'm a true
ಪ್ರಾಬ್ಲಮ್ ಮಾಡ್ಬೇಕು
It's 06. They call it more right. This is last call. Okay. I've been in touch with him. We are studying him from Shakespeare. Probably so preventive care is important. They can see. What are these? And almost the proper question they have any chronic students, they have found the next level by the subject. This is a good. That's one I'm so upset with the but I think I'm going to do it. Okay. I did see. Andre also.
ಎಲ್ಲರಿಗೂ ನಮಸ್ಕಾರ. ವೆಲ್ಕಮ್ ಟು ಆನ್ಲೈನ್ ರಿಜಿಸ್ಟ್ರೇಷನ್ ಫಾರ್ ಕಾಸ್ಟ್ ಎಂಪ್ಲಾಯ್ಮೆಂಟ್. ಈ ಪ್ರೊಸೆಸ್ ಮಾಡೋದ್ರಿಂದ ನಮ್ಗೆ ಯಾವ ಕಮಿಟ್ಮೆಂಟ್ ಇರಲ್ಲ. There is no fees is required, nothing is required. And for some reason you don't want to get empaneled, there is no issues at all. Then ಯಾಕೆ ಮಾಡ್ತಾ ಇದ್ದೀನಿ ಅಂತಂದ್ರೆ NHS has developed this software and they have developed this software for so many other schemes also. CGHS, Nagaland, CAS, Ayushman Bharat ಎಲ್ಲದಕ್ಕೂ ಮಾಡಿದ್ದಾರೆ. Therefore, it's not easy for you to complete the online process. For that, we have taken this figure. Welcome to all dental colleges for online registration. Next. Scheme ಬಗ್ಗೆ ಯಾರಿಗೆ ಇನ್ನೇನಾದ್ರು ಡೌಟ್ ಇದ್ರೆ ಕೇಳ್ತೀರಾ? Any doubts regarding CAS scheme? If there is nothing, we'll just go ahead with the scheme. I will explain in gist. One day on the submission of application first. There is no commitment at this level. You fill all the details up. Whether it's a dental college or a diagnosis center or Ayush, the application form is uniform for everybody. There is no distinction between empanelment criteria ಏನು submit ಮಾಡಬೇಕು, government fix ಮಾಡ್ತೀರೋ, there is nothing to do with this submission of application form. Empanelment criteria ಏನಾದರೂ ಬಂದರೆ, there is empanelment committee that will come and inspect it and they say yes or no. And once the empanelment committee, the district empanelment committee, they will come and inspect it. And if everything is in order, they recommend it to state empanelment committee. And if state empanelment committee approves it, then they will send a message to the concerned college or institution to sign MOU, Memorandum of Agreement. Adalu ವಿಶೇಷವಾಗಿ ಏನಿರಲ್ಲ, it will be available as a draft form in the website. ಆಮೇಲೆ ಒಂದು ಫೀಸ್ ಕಟ್ಟಬೇಕಾಗುತ್ತೆ. ಫೀಸ್ ಅಂದರೆ ಅರೌಂಡ್ 20,000 ಇರಬಹುದು in approximate. Government has to notify those things. That fees is for 5 years. Once you pay the fees and sign MOU, then it is called activation of the figure. Then whatever the application you have given, that will be activated. The moment it is activated, you click patient's name, login, and KJD number ಹಾಕಿದಾಗ you will get the patient's photo and everything. Once you identify the patient, you register with the Aadhaar card OTP number once for each patient. Once it is registered in any institution where patient is identified, next time onwards, whenever he comes, you see the photo and you can visit it. And after treatment is over, you will, when patient comes, you identify the patient, see the photo, register it, and then ask if routine investigation, consultation as routine investigation, you will do it. If it is less than 350, it is auto approval. Then, if it is more than 350 rupees, you will ask for pre-op. Once you give pre-op, you can go ahead with the procedure and do it. As Madam was talking, if a patient doesn't come for complete, whatever you have done, to that extent you can claim it. It is not very problem. Now, to empanel, this contains 4 stages. One is account creation. Now, whatever we are going to do is in account creation, account activation and empanelment request submission, empanelment application completion process, empanelment application approval process. Empanelment application approval process is done back end. You will be doing only 3 stages. Now, all of us are going to create an account step by step. Madam will keep on showing step by step how to go about it. Most probably, I hope all of you are ready to do this one. Maybe Madam will just explain the whole process so that you will have a mental picture how the things will go. Then step by step you go. First time you need not do anything. Wait for some few minutes. She will explain.
Okay, the first step is account creation. See, there is a website there, pmjay.gov.in. You open that website in any browser and you will be headed to this screen. There you select other scheme empanelment and then you will have a creation, account creation page. So you have to ensure whatever the mobile number and email ID, whatever you give, it is correct. So to that email ID or mobile number, you will receive an hospital ID or reference number and the password. Okay. Using that password, you have to log in.
1 minute. This mobile number is very, very important. Please keep a mobile number which is always used. If today use it and somebody tomorrow this mobile number changes, there will be a lot of problems. Please ensure the same mobile number because there is one more thing known as Ayushman Digital Mission. This one. There, all your data of the previous data of the patients can be retrieved. For that, this HFR is very important. Therefore, mobile number should be same. Please don't write a mobile number of your child. Whichever hospital has given, that is very, very important mobile number.
And if you give the mobile number which the hospital uses and the same email ID which is being used by the hospital, that is well and good, so that anyone can
access it.
Even if you leave the job, somebody else has to be in a position to do it.
Please use the email ID of the hospital only and use official phone number for that dedicated for that hospital.
Sir, there is no process to change of mobile numbers.
Very difficult because there are so many things are involved. It's not one. And there's only one mobile number. For some reason, you have registered now this one. You donate this number to hospital.
Okay, once you create your account, you will submit and you will receive a login ID and password. Okay. Using that login ID and password, you will log in into your account. Okay. Once you log in into your account, you will have some secret questions to answer, 3 questions. You will answer those secret questions, save and submit. Once it is done, you have to change the password. The password which you have received is the temporary password. Now you will give a password which is of the character length 8 to 12, one which involves 1 capital letter, 1 small letter, 1 number and 1 special character in it. So that you have to remember this password and then you will change and save it. Okay?
Only. We will share this screenshots, everything for everybody's email. There's no need to take mobile visa. We'll share it to everybody.
Once this is done, you will have a like home page kind of thing where you have the different modules like hospital basic information, financial details, specialties offered, licenses and certification. All these tabs you need to fill in and finally you will check the eligibility and then submit. Before submitting, you will also have an HFR linkage, that is Health Facility Registry. Some people might already have this HFR number. If you already have, you can just enter it. You will get an OTP, you will validate it, and then you can submit. Those who don't have, not a problem. I will help you in creation of HFR ID. Okay?
Two things. Yeah. By mistake, you have done a wrong entry. Nothing to worry, you can edit yourself. Until you check the eligibility and submit. There only if it is submitted, then you have to send an email for us, we will change it. But before you submit the final one, you are free to change it anytime. Even if you have saved every page, there is an option for editing all the things. And HFR is very important, means all the previous data of the patients, medical history, everything you can access through that data. And it is mandatory for all the government hospitals as and now. And in CAS, it is made mandatory for all hospitals which are employed under CAS.
This each field I'll explain. Hospital basic information will contain like address, phone number, which district, and then taluka, everything. And then it will also contain latitude and longitude for the beneficiary to locate your hospital address. These are the basic information you will fill in. save, and then go to next. The next tab is financial details. Here you have the hospital bank account details, IFSC code like cancel check copy, everything you will upload. It should be in a PDF or JPG format. Once you submit it, next is specialties offered. Specialties is whatever the specialties which your hospital is offering. Those things you will just check it as just a check box. You will tick whatever the specialties offered in your hospital, save, and then go to the next.
1 minute. Specialties offered means all the specialties available in that institution. You should not miss anyone because something is paying more. I will ask this one. I don't want to give this one. Nothing like that. You will offer whatever is available within that organization. Now somebody asked MS Ramaya Medical College got a dental department. Therefore, they have to offer all the things whatever is available in that institution. If you have got a diagnostic center, you will have to, it's mandatory for you to offer those things. You can't say I will give this one. I don't want to give this one. It is a whole package.
I have a query. We offer oncology services under Zuleika Enabra Institute of Oncology.
If it is within your institution, yes.
Within our institution.
Within your
We
institution.
have provided services.
Yes, all the things. Whatever is available within the institution, you can't deny somebody. It doesn't pay. I don't want to give it. Dental oncology is there. You have full liberty to
We co-offer.
The next tab is licenses and certification. This is all about ambulance certificate. You have these kind of certifications you have to upload in this field. Civil infrastructure will be like yes or no. Whatever the infrastructure you have, you will write yes. If it is not there, you will write no. The same thing holds good for medical infrastructure and general services. Okay.
Here, whatever is the fact you write it, don't give anything imaginary because government somebody may come and check it up. If ambulance service is not available, you say it is not available. It is not mandatory you should have ambulance service. If it is there only, you write it. If there is a tie-up with ambulance, you say a tie-up. With laboratory, if it is a tie-up, you say it is tie-up. If there not be any ambiguity, so tomorrow if somebody comes and verifies it, it should be there.
And the next field is manpower details. Here it is all the doctors who are working in the hospital. So whatever the specialties you have clicked there in the specialties offered tab, that is related to this. So for each specialty, you will include one doctor. Okay. And this also includes if a technical person also like laboratory you have ticked in your specialties, so that one technician you will add and one Medco and one Ayushman Mitra. Like Madam explained you about Ayushman Mitra, that like any contact person, first point of contact in your hospital, you can call as Ayushman Mitra as of now. And you can upload that information.
Ayushman Mitra is nothing but a nodal person from your hospital.
Yeah.
Who we can contact, who we can respond. We will respond to only one person because if too many people ask, we don't know what is correct, what is not correct. Because only one person as nodal person, that nodal person name only you can write his email, his phone number, all those things. And regarding ending the manpower, there will be too many people working in a hospital. Especially being a college, maybe 50, 20 or 100 may be there. Don't enter everybody's name today. Only one person name is sufficient. And you can add leisurely at any time you want.
And then this, the next tab is this attachments. This includes NABH certification. If you are accredited to NABH, you can upload that certificate, or else you can say our hospital is not accredited with NABH. You can give the self declaration and you can upload it. MOU is that memorandum of understanding that will be signed by you once it is released from the government. As of now, you can say signed copy of MOU will be submitted to Office of fast and you can give the self-declaration and upload it. And this CAS undertaking form, you can download it from the portal itself. It is there in the tab. You can download, put your signature, sign, and seal, and you can upload. These are the only 3 mandate forms you have to upload in the attachments.
And we add this bit. NABH is not mandatory. If you are NABH, you say NABH. If you are not NABH, it's not NABH. That's all. Registration number. This is called KPME registration number. If hospital is entered, KPME registration is there, you write the number. If for some reason it's not there, you write right now 000. The moment it is, you get KPME registration, you write the correct number. And MOU, if somebody, a hospital has already empaneled under any scheme under government, like empaneled under state government projects or SUST, you can upload that one. There are 2 MOUs. One is with CAS. If you are already empaneled, that one you can write now, you can empanel. Other one with CAS, we give a draft it, once government approves it. If you are eligible, then only that will be shared with you. And once you sign it, that becomes a final document. This MOU is meant only for if you are already empaneled under SUST or any government, not any, DPR or health department. If you are empaneled for government service purpose, then only you can enter that MOU. If you have got an MOU. Otherwise, you leave it blank, nothing will happen. Undertaken from hospital, there is no issue.
And finally, you will check the eligibility, like whatever you have filled in, you will save and then check it and then submit.
Here, this check on eligibility. You fill up all the things, save it. Finally, when you click it, everything will be red because we have done all wrong things. Again, you have to go back and correct the whole thing. And this one.
Some of the
Majority.
things will
Majority. We think it's very easy to fill it up. I have seen whenever we fill up, everything was completed. That's the reason we call this training program so that we do correctly. We start now. Everybody knows the flow, how it works.
It's only trial now, sir. It's only trial.
Till now.
No, even now when we start the process.
No, nothing will happen, madam. If the mistakes can be corrected anytime you want, at your own level. But it is a real, not a dummy at this one, this will be real one.
But it can be edited later.
It can be edited.
before submission, they can edit.
That's what, before submission. We are not going to submit anyways, because they have to speak to the dean.
Yes,
It's only the.
When one is willing, we can start the process.
No problems.
Keep the form every.
Yes.
And submit.
Don't submit.
Submit.
Yes. Yes, yeah, I think that you can start. If all of you are willing, you can start the process.
Even check and submit everything, you click it. You get all the mistakes, whatever you have done. Correct it, keep it everything pakka, then only you can submit.
So, Ramya, from step 1.
Can everyone open any browser? Please open any browser and type ABPMJAY.
I suppose I will not.
Type ABPMJAY and go to the first link. Yeah. Yeah, there you click hospital empanelment. You get the quick things, right? Then hospital empanelment. Yes.
Third one, other schemes empanelment.
Hospital empanelment. Then left side you can see others scheme empanelment here. Click on that, then you will get the account creation page. You get an account creation page and create your account. Give the mobile number and email ID. This is the new hospital. You will get a SMS.
ಮೊಬೈಲ್ ನಂಬರ್
We don't have the number.
ಯಾರು ಕೊಡೋದು ಸರ್? ಪ್ರಿನ್ಸಿಪಲ್ ಇದೆಯಾ? ಯಾರು ಕೊಡೋದು? ಅಷ್ಟು ಸಪ್ರೇಟ್ ಮೊಬೈಲ್ ನಂಬರ್ ಇಲ್ಲ.
Mobile number.
ಇವಾಗ ಹೇಳಿದ್ಮೇಲೆ ಬರ್ತಾ ಇದೆ. This one, then we can how we can arrange that. So this becomes important. Then after that,
ಹೌದಾ?
everything is over.
ಹೌದೌದು. ಓಕೆ.
Submit matter.
District
This is the same concept.
That's the problem. We are private, other we are That's the problem.
I'm logging because you have created now.
Please give the mobile number, whatever you are having it, because all OTPs keeps coming here. As of now. Afterwards, you try to give this, reserve this number forever for the college.
Challenge ಆಗುತ್ತೆ.
Otherwise,
So before we submit, probably allow us to add the new number that we will go and create. So we'll go and finalize.
This
Sir, is it over?
Sir, is it possible that we put your mobile number?
Registration name.
Do a proceed your size.
If you not take, if I already registered with my mobile number, it will say mobile already registered. Because it's software, it knows everything.
Empanelment site state specific.
correct.
Third one,
Any question?
any query regarding mobile numbers?
I thought we'll put on one.
We can put on.
Problem.
So PAN number PAN number is Mandala. College PAN number is ಹೌದೌದು ಅದರಲ್ಲಿ ಮೀಟಿಂಗ್ ಬಂದಿದ್ದೀವಿ. ಅದು ಅಪ್ಲಿಕೇಶನ್ ಹೆಂಗ್ ಫಿಲ್ ಮಾಡೋದು ಅಂದ್ಬಿಟ್ಟು ಒಂದು ಡೆಮಾನ್ಸ್ಟ್ರೇಷನ್ ಕೊಡ್ತಾ ಇದ್ದಾರೆ. ಹಾಸ್ಪಿಟಲ್ ಪ್ಯಾನ್ ನಂಬರ್ ಅಂತ ಕೊಟ್ಟಿದ್ದಾರೆ. ಅದಕ್ಕೆ ಪ್ಯಾನ್ ನಂಬರ್ ಇವ್ರು ಸಿಂಗಲ್ ಮಾಡಿದ್ರೆ ಬಿಸಿ ಬರ್ತಾ ಇದೆ. ಅದು MSMI ಕಾಲೇಜ್ ಯಾವುದೋ ಒಂದು ಗೌರ್ಮೆಂಟ್ ಏನೋ ಮೀಟಿಂಗ್ ಇದೆ. ಅದಕ್ಕೆ ಫಾರಂ ಅಲ್ಲಿ ಹೆಂಗ್ ಫಿಲ್ ಮಾಡೋದು ಅಂತ ತೋರಿಸ್ತಾ ಇದ್ದಾರೆ. ಫಾರಂ ಅಲ್ಲಿ ಹಾಸ್ಪಿಟಲ್ ಪ್ಯಾನ್
ಮೊಬೈಲ್ ನಂಬರ್ ಚೇಂಜ್ ಮಾಡೋ ಆಪ್ಷನ್ ಇದೆ.
ನೋಡಿ ಇಲ್ಲಿ ತಿಳಿತ ಪೂರ್ತಿ
See here in the demo only.
ಇಲ್ಲ ಏನು ಎಲ್ಲಾರ್ದು the same problem. Not one of them.
Slides.
ನಂಬರ್ ಬೇಕು ಪ್ರಿನ್ಸಿಪಲ್ ನಮಗೆ ಕೊಡೋಣ.
ಎಲ್ಲ ಆಯ್ತಾ? ಮೊಬೈಲ್ ನಂಬರ್
ಎಲ್ಲಾರ್ದು ಆಯ್ತಾ?
Hospital of that goes to a different screen altogether.
ಇದೇನು ಪ್ರೈವೇಟ್ ಹಾಸ್ಪಿಟಲ್
Do you have a Rohini again? No, okay.
Hello? Hello?
Somebody said it, okay. Can you some number you come here?
Hello?
You are hospital name.
Not for profit and it was
Hello? Hello? ಆನ್ಲೈನ್ ನಡೀತಾ ಇದೆ, ಅದಕ್ಕೆ ಮೀಟಿಂಗ್ ನಡೀತಾ ಇದೆ.
Is everyone in the account creation page? Yeah. Yes.
Do you have a Rohini ID? We are not in the Rohini ID. It is currently not
Everyone in the account creation page?
ಮಾಡ್ತೀರಾ? ಮಾಡ್ಬೋದು, ಅರ್ಜೆಂಟ್.
Empanelment that is auto populated, you need not change it. Then hospital state is Karnataka. Hospital district is the whichever district you have come from, you will select it from the drop down. Is that fine? Then write the name of the hospital there. Then hospital parent type is single or group. If you are a single institution, then you can give single. If you are a group of institutions, you can select as group. Then contact person mobile number, whichever is accessible now, mobile number and email ID you will enter. So to this mobile number and email ID, the hospital reference number and password temporary, that will go to this mobile number or mail ID.
If you don't have option, maybe access, you give your mobile number so that you do that.
Email ID also.
Mobile number and the password for 13 days. How do you
ಹೇಳು.
Is it fine? Then hospital size. If it is a government, you will select public, otherwise private, not for profit.
Small Allah.
Then empanelment type is state specific empanelment.
What's the purpose?
Yeah.
If we put
Not
that.
for profit is, because it's a college, no, ma'am. So it's not going to be making any profit. Oh.
Then the next field is, do you have a Rohini ID? As of now, it is not there. You can give us no. Okay? Till now, did everyone? Hospital subtype. Whatever in the drop down, you select and give the subtype. Proprietorship, private entity or companies. Then you enter the hospital PAN number. Yeah, number hospital PAN
Double eight.
Oh,
671. 671. Double two. 939.
and then enter the caption and create the account. Before creating the account, make sure the email ID and mobile number which you have given is correct.
And you have got access for those.
So strain on this. So reduce left. They can access it. OTP ಬರುತ್ತೆ. Mobile ಗೂ ಬರುತ್ತಾ?
Okay, now you in your mobile you would have, once you create the account and confirm, you will get a dialog box. If okay, are you sure you want to create an account? If okay, now you would have received the license number and hospital mobile number or mail ID. If you have not received in the mobile number, check your mail ID in the inbox. If it is not there in the inbox, it will be there in the spam.
It's asking for hospital PAN.
Yes, you have to enter the hospital.
Email also.
You can enter ABCD, 1 to 3, 4, last name, anything you can say.
Create account.
One more question.
PAN should be in this format. The phone number.
Reference ID and password. Right side there is a tab here, right? Here you will go and enter that reference ID and password. Yes. Enter only the password is only the number.
The phone number check. 450 53.
Password is only 4-digit number. Don't type that NHA which you have put at the end. This is very important because and NHA also, and they say they're not able to log in. Password is only 4-digit number, what you have received.
True side.
The hospital nutrients will be employed.
Yes.
Caps.
No, you can enter it.
16814.
1347. Okay. Second.
No more.
You will value the PAN number.
Passwords.
Enter the.
Hey, madam, ask you to, it's not the valid PAN number. Bank yourself.
Now everyone are in that secret questions page. So the secret questions, those secret questions, all the three can be the same also. It is just to remember. All the three can be same also.
You take a photo shot of those things. That may be required if you there's a problem, open the account.
It's a message saying.
We will see.
Sure, sweet.
The relative are making 168 also.
But finally, you we can come again. ABC to 30. Apollo. I remember. We very green. You know, top not done. ಬಂದಿದ್ದಾರಲ್ಲ ಬರಲೇಬೇಕಾಗ್ತದೆ Please go ahead.
Go ahead.
Password reserved for mobile game and mail ID for the it's a reset. So they don't take it. So we need to get that number.
ಕಂಪ್ಯೂಟರ್ ಅಂದ್ರೆ ಇದಕ್ಕೆ ಮೊಬೈಲ್ ಬಿಲ್ ಸರಿ ಸ್ಕೂಲ್ ಫಾಲೋ ಮಾಡಿ ಸ್ಕೂಲ್ ಅಂತ
ಜೊತೆ ಪ್ರಿನ್ಸಿಪಲ್ ಮೇಲ್ ಐಡಿ ಹೋಗಿ ಒಂದು ಕಂಟಿನ್ಯೂ ಕ್ಲಾಸ್ ಅಂತ ಸಿಎಸ್ಎಲ್
You will get the screen for password update. So the old password is the 4-digit number which you have received. The new password, what I told you is it will be a character length 8 with one uppercase, one lowercase, and one special character and one number. Okay, this password you have to remember every time you log in. The hospital ID is the one which you have received for your mobile, and but the password is the one which you have entered now. Okay. Once you change the password, remember that password. ಇವಾಗ ಎಲ್ರು ಎಲ್ಲಿದ್ದೀರಾ? ಯಾವ ಸ್ಕ್ರೀನ್? You're doing?
Form 16. I'm Form 16. TV and 70 block. Thank you. TV. So you see,
Mobile number college.
ಮಾಡಿದ್ದೀವಿ ಆ ಬೇಕು ನಮ್ಮ ಚೇಂಜ್ ಮಾಡಬೇಕು ಬೇಕಿಲ್ಲ ಬೇಕಿಲ್ಲ ನಾಲ್ಕು ಚೇಂಜಸ್ ಮಾಡಬೇಕು ಮೂರು ಹತ್ತಿರದಲ್ಲಿ ಮೂರು ಹತ್ತಿರ ಮೂರು ಮಾಡುತ್ತೆ ಇಲ್ಲ ಅಂತ ಏನಾಗುತ್ತೆ going to a place
ಅಥವಾ ಇದು ಮೊಬೈಲ್ ನಂಬರ್ ಯಾರ ಹತ್ರ ಇದೆ ನಾನು ಕೇಳ್ತೀನಿ ಸರ್
ಇದರ ನಂಬರ್ ಮತ್ತೆ ಕೊಡ್ತೀರಲ್ವಾ ತಗೊಳ್ಳೋಣ ಇದು
Now go to the left, you can see all the tabs, hospital basic information, financial details. Click on the basic information and start filling.
Finally, none the auditor that to register. Inputting and taking off. I
Hello. Good afternoon, ma'am. So system on the quick and sending off to both.
Sir, if you don't have notification to relay permission from your.
Yes, it's ma'am. On the
Whole process can be deleted, they will not get it. You go ahead and.
we have bit mail ma'am. Password ಬಂದಿರುತ್ತೆ hospital reference number and password.
Yeah. Others giving us. Karnataka's. Filling marking last year.
ಏನ್ ಬೇಕು ಡೀಟೇಲ್ಸ್
Hospital admission, desk line,
Screenshot a bit more. I will send it off to you in I. And I leave it. Mention directly on our.
ಅವ್ರ ಟ್ರಾನ್ಸಾಕ್ಷನ್ ಇದೆಲ್ಲ ಬರೋದು ವಿಶೇಷ
ಇಲ್ಲ ಮೆಸೇಜ್ ಇದೆ
ಎಲ್ಲ ಈ OTP ಬರಲ್ಲ. Everybody ma papa. ಸಂತೋಷ ಬೇಗ ಮಾಡ್ಕೊಂಡ್ಬಿಡ್ತಾರೆ ಸಂತೋಷ ಆಲ್ರೆಡಿ ರೆಡಿ ಆಗಿದ್ದಾರೆ ಮ್ಯಾಮ್ ಹೇಳ್ತಾರೆ ಮ್ಯಾಮ್ ಆಮೇಲೆ ಡಿಪಾರ್ಟ್ಮೆಂಟ್
License.
ಇದೆಲ್ಲ ಹಿಂಗೆ ಫಿಲ್ ಮಾಡಬೇಕು
Take a very long time. Go with the process of what it is. You want to continue the process, huh? Yes. State limit restriction whether.
You put and 0
That's it. Right.
ಇಷ್ಟೇ ಬಂದಿದೆ
it will be deleted.
Hello. Yes, I'm here.
Yes.
At this level,
Live on the table.
Then you address the license. Please say further. Their comfort inspection, their comfort inspection, it was I already directed.
I'm just making the.
You ask the leader of the
WhatsApp is
We want to go.
So we are getting the information, or in case we need to modify it, edit it.
So I contact number, email ID. Password number from there. Hotspot on.
Four digits, no after. It's not a
We don't have KBME. KBME is not like.
1, 6, 8,
It's mandatory.
Zero. Yes, okay. So on the then our office over. Is it not page and online. Enterprise longitude wrong.
Zero could not be lost.
Say one.
It's not taking the.
Please make it fun.
Yes.
Degree.
You know. G categories, specifics, not small letters, again, R O O N, info, to, at.
Code launched you.
To manage the teams. But it's not mandatory.
Screen guard, screen guard.
NABH.
Actually, it's blind development.
This is longitude. You need to copy the entire thing.
Already logged into the application. Okay.
Yeah. This is not.
Valid fields.
It's bad.
Sagilan, the others. 7.
He doesn't want us to say him.
Yeah. You know, number. Banded. 080.
Okay.
Yes, sir. Low marks will give you more personal.
Legal and
6, 7, 8.
But you have to go in that direction. Thank you.
That's what I'm pretty hard on. Yeah.
Finished filling the basic information. Everyone?
Sir.
Purity.
What is the future everything registration date, right?
I think there's
Karnataka State Council availability.
KPM authority
all the way from that. Is it not?
It's for through financial details. Save and go to financial details.
Organization.
Any problem for anybody?
Those are problem with that, you can not do. Type your hospital name, the browser, keep that into letter number. That number you have to put it there.
ID proof, right? ID proof.
ID proof, I put the bad number or something.
Only the line.
Code officer info.
And every code. ಇದು ಪ್ರಿನ್ಸಿಪಲ್
Good morning, sir. Sir, ನಿಮ್ದು ID proof ಬೇಕಾದ್ರೆ ಸರ್ ಪ್ಯಾನ್ ಕಾರ್ಡ್ ಕೊಡ್ಬೋದಾ ಸರ್ ನಿಮ್ದು? Sir, can I get chapter details of WhatsApp message assistant for ನಿಮ್ದು? I'm typing, sir, you must like it, sir.
C.
What's the share?
PP. Sir, repeat me, sir. A for apple, I for egg, R for rat, P for parrot, 864. Okay, the 86482. Okay, sir, I didn't matter. Got that. Okay, sir, thank you, sir.
So check.
Sir?
So check.
Sir.
Check.
ನಿಮ್ಮ personal contact number ಕೊಡ್ತೀರಾ? The principal contact number ಕೊಡಿ.
We thank all the online participants for the today's event. So we'll be ending the live streaming as of now. All the details relevant to the program process will be shared through mail. Thank you, everyone. Yeah.
ಇದಾದ್ಮೇಲೆ ಎಡಿಟ್ ಮಾಡ್ಬೋದ್ರೆ ಏನು ಪ್ರಾಬ್ಲಮ್ ಇಲ್ಲ ಅಲ್ಲ ಆರ್ಗನೈಸೇಷನ್ ಹೆಡ್ ಮೇಲ್